About 25 years ago, I noticed that I started having a hearing loss. There would be times where I couldn't talk on the phone. I couldn't hear anybody talk. I wouldn't want to go to restaurants because I didn't want to talk to the waiter. And there was just more and more times like that that made it very difficult to hear, and it was time to do something.
It's patients who have lost a little bit of hope that they may go through the rest of their life not being able to hear, and probably even more importantly, not being able to communicate and socialize with the outside world. In the past, people from the Northern Virginia area have had to drive long distances to get cochlear implants, which may or may not be as big of an issue if it only consisted of getting the surgery itself. But there's a significant amount of pre- and post-operative sort of counseling and rehabilitation that has to take place. And so when you have to drive over an hour for each of these visits, it becomes a hassle and can actually become a barrier to getting a cochlear implant. And so this is exciting technology that's being offered in the Northern Virginia area. And our program specifically stands out in that it offers patients the choice of all three cochlear implant companies.
It took about 5 days to start feeling back to normal, but that, I don't know if that was so much the surgery itself. I think it was more like recovering from anesthesia and everything. So it takes a while not only to recover from the surgery, but then you are waiting for 4 weeks to be activated. So here you went through the surgery, and it's frustrating because you're also waiting to find out if this implant works.
We typically wait about 1 month after the surgery to turn the device on. And that is purely because we're letting Linda's incision heal and all the swelling to go down so that the connection between the external component and the internal component can be as strong as possible.
We just activated Linda's right cochlear implant. What we did is we took sound, we made measurements along different parts of the internal cochlear implant to make sure that she could handle electrical current in her ear. Then by using the implant, it transfers acoustic sound into electrical sound. With practice and listening every day, she will hopefully be able to hear sound like she did 30 years ago. When I talk, are you aware that you're listening to speech?
Yes.
Good.
Yes, I am not just reading your lips, I can hear you.
Perfect.
Your voice sounds as echoey as mine.
Okay.
But I'm hearing the words.
Good.
Yeah.
Echo on the first day is very normal. Perfect.
Okay.
Saturday.
Saturday.
Monday.
Monday.
Wednesday.
Wednesday.
Tuesday.
Tuesday.
Yeah.
Did I get them all right?
Yeah.
Yay.
That's very good.
Okay.
Oh.
For every 100 people who have hearing loss bad enough that they would qualify for a cochlear implant, only 5 actually get a cochlear implant. And part of that is healthcare dollars, but part of it is still awareness that this technology even exists.
I think Dr. Lin is specifically wonderful. He's the one who gave me back my hearing. I think he's a pretty wonderful guy.